Welcome back to the deep dive. Today we're getting into something, well, something almost everyone has dealt with, I think. Acne.
Oh, yeah, definitely.
And for a lot of people, it's just so frustrating, right? And it sticks around way longer than just the teen years.
It's incredibly common. Honestly, one of the top reasons people see a doctor about their skin, like globally.
Wow, okay.
Yep.
That really shows you how big a deal this is. So for this deep dive, we've gathered up your sources, articles, some really interesting research, our notes, and we're going to try and unpack what acne actually is.
Yeah, and dig into the causes, which can be kind of surprising sometimes.
See, exactly. And look at the latest, evidence-based ways to manage it.
Mm.
The goal here is really to give you a much more complete picture, going beyond just like spot treatments.
Okay, so let's start right at the beginning. What is acne, fundamentally?
Good question.
Well, at its core, it's an inflammatory process. It happens in what we call the pilosebaceous unit.
Pilosebaceous too. Okay, break that down.
Sure, it's basically the hair follicle and the oil gland, the sebaceous gland that's attached to it.
Got it. And these units, they're not just on the face. I think a lot of people just think face.
No, not at all. That's a key point. They're pretty much everywhere on your skin except the palms of your hands, soles of your feet, and mucous membranes.
So that means you can get acne basically anywhere else.
Yeah.
Scalp, back.
Exactly. Scalp, face, chest, back. It's definitely not just a facial thing, even though that's what we often focus on.
Right. And when we think about like the typical timeline for acne, well, everyone thinks teenagers.
And that's true. Adolescent acne is super common. It's driven mostly by all those hormonal changes, the glands developing during the teenage years.
It doesn't always stop there.
No, it doesn't. And that's the crucial thing about adult acne. This is acne that either keeps going after 25 or even starts after 25. Affects men and women.
And the cause is different then, not just hormones maturing.
Generally, yeah. It's usually less about the endocrine system maturing and more about existing imbalances that are ongoing.
Okay, and ongoing internal things. That's a really important difference. So let's dig into those core mechanisms. What's actually happening under the skin?
Right. Understanding these is key. There are basically three main things going on. First, you get gland obstruction. Think of it like a little plug.
A plug.
Yeah, a corneal plug. It happens because the cells lining the oil duct don't shed properly. They kind of clump together and block the opening. That's your basic come down, like a blackhead or whitehead.
Okay, so step one, clogged pore. What happens next?
Well, that plug often happens alongside the second mechanism.
Mm-hmm.
Hyperfunctioning glands, the sebaceous glands just get kicked into overdrive.
Making too much oil, sebum.
Exactly. And the triggers for that can be hormonal, sure, but also lifestyle stuff, your diet. Even genetics play a role. It's usually not just one thing.
Okay. Blockage, extra oil.
Hmm?
What's the third piece?
The third piece is microbiota imbalance. So our skin has this whole ecosystem of tiny organisms, bacteria, and such.
Right, the skin microbiome.
Yeah. And in acne, there's often an imbalance, particularly an overgrowth of one specific bacterium called Cutibacterium acnes. Used to be called P. acnes.
Ah, okay. So the blockage traps the oil, and then these bacteria kind of thrive in there.
Pretty much. That combination, the plug, the excess oil, and the bacterial imbalance, that's what leads to inflammation.
And the inflammation is what we actually see, the red bumps, the painful spots.
That's it. If the inflammation isn't too bad yet, you might just see the come down, the blackhead. But when inflammation kicks in, you get the redness, the swelling, the soreness.
And you mentioned genetics before.
Yeah, there's often a genetic predisposition, so if your parents had acne, you might be more likely to. It means conditions like acne or even rosacea can be kind of chronic for some people.
So it comes and goes, flare-ups and remission.
Exactly. Periods where it's better, periods where it flares up. And those flare-ups sometimes are triggered by obvious things like stress or maybe certain foods.
But not always.
Not always. Sometimes it's frustratingly unclear, or it's just a combination of many little things adding up.
Okay, this is making a lot more sense. Understanding those three core things, the plug, the oil, the bacteria, leading to inflammation that helps frame it. So what can we actually do? Let's talk treatments.
Right. Treatments. If there's one takeaway treatment-wise, it's probably retinoids.
Okay, retinoids. Heard of those? Vitamin A derivatives, right?
Yes, exactly. They are really the cornerstone, the most used treatment, and for good reason. They actually work on all three of those mechanisms we just talked
All
about.
three. How?
Well, they speed up cell turnover, which helps stop those plugs from forming in the first place. They also help shrink the oil glands a bit and reduce sebum production.
Okay, so less plugging, less oil.
And they help regulate the Cutibacterium acnes levels. Plus, that faster cell turnover just helps the overall skin process. They're kind of a multi-tool.
That sounds really effective. What forms do they come in? Just creams?
Mostly topical, yeah. Things like retinoic acid, tretinoin, adapalene, you put them on the skin. There's also an oral form, isotretinoin, which is a very potent vitamin A analog.
Isotenian.
Right.
That's the one often known as Accutane or Roaccutane.
That's the one.
And that specific one. It's had a bit of a controversial history, hasn't it? Kind of a bad rap.
It definitely did. For a long time, it was associated with some pretty significant side effects, especially really bad dryness, sensitivity, mood changes were discussed too.
Why was that?
A lot of it came down to the dosing. Historically, the doses were often calculated almost mathematically based just on body weight. They were quite high doses.
Sort of a one-size-fits-all heavy-handed approach.
Pretty much. But medicine and dermatology especially has really evolved. The approach now is much more, well, integral and patient-focused.
How so?
Today, the doses of isotretinoin used are generally much, much lower. They're carefully adjusted to the individual, their skin type, how severe the acne is, their whole situation.
Ah, so it's more personalized, fine-tuning the dose.
Exactly. And because of that, the side effects are drastically reduced. It's much more manageable now.
It sounds like finding the minimum effective dose, right? Like we hear about with other meds sometimes.
Precisely. That's the goal across much of medicine now. Get the results you need with the absolute minimum dose required to minimize any unwanted effects. We see it with things like finasteride for hair loss too. Lower doses are often used now.
Makes total sense. Optimize the good, minimize the bad. What about just like a basic skincare routine? Does that still matter when you're using powerful treatments?
Oh, absolutely. It's not optional anymore. It's really a vital part of the therapy.
How does it help?
Proper cleansing, using the right gentle products, it helps reduce the chance of those plugs forming and stops you from like overstimulating the oil glands by stripping the skin. It supports what the treatments are doing. Think of it as creating a healthy foundation.
Right, sort of protecting the skin barrier and keeping things calm.
Okay.
Okay, besides retinoids, what other treatments are common?
Well, other topicals are still useful. Salicylic acid is good for exfoliating. Niacinamide is great for calming irritation, which topical retinoids can sometimes cause.
Okay. And what about things done in a clinic?
Yeah, in-office stuff helps too. Lasers can target inflammation. Chemical peels, maybe with isoleic acid, help with exfoliation and sometimes marks left behind.
Microdermabrasion. Does that fit in?
It can, yeah, for exfoliating those plugs, the comedones. But you have to be careful. If the skin is really red and inflamed, you probably wouldn't do that first.
Right. Calm the fire first, maybe with antibiotics.
Exactly. Sometimes systemic antibiotics are needed for a period to get inflammation under control. But again, it's about using them appropriately, right dose, right duration, not just indefinitely.
Got it. Okay, that covers a lot on the skin itself, but we sort of hinted earlier, acne isn't just skin deep, is it?
Yeah.
Let's talk diet, hormones, environment. That microbiome link seems huge.
It really is. And it connects the skin and the gut. We can use probiotics for sure. There are even specific probiotics aimed at skin health now, which is interesting.
So adding good bacteria can help the skin.
It can help rebalance the skin's ecosystem, yeah. But, and this is really important, probiotics are kind of an outside fix, an exogenous method. Meaning, if you don't address why the microbiome was out of balance in the first place, maybe it's diet, maybe it's hormones, then just adding probiotics might only be a temporary help. The problem might just come back.
Ah, okay. So you need to fix the underlying cause of the imbalance, not just paper over it with good bacteria.
Yeah.
Makes sense. What about diet then? What's the evidence there?
Diet definitely plays a role. Things like saturated fats, lots of simple sugars, they can mess with your gut bacteria and increase inflammation systemically, like throughout your whole body.
And that shows up on the skin.
It can, yeah. On the flip side, diets known to be anti-inflammatory, like a Mediterranean-style diet or even paleo for some people, they often seem to help reduce acne.
Interesting. And hormones. We touched on them, but how big a factor are they, especially in adult acne?
Huge. Proper hormonal balance is crucial. It's not just about having the hormones, but about your body metabolizing them correctly, breaking down sex hormones like estrogen and testosterone when they're done doing their job.
So if your body isn't clearing them out properly,
imbalances can occur, and that can absolutely trigger skin issues like acne.
Okay, which leads us neatly into something that feels increasingly talked about. Endocrine disruptors. What are these?
Yeah, this is a big and honestly pretty concerning area. Endocrine disruptors are basically chemicals that mess with our body's hormone system, the endocrine system,
How do they mess with it?
often by mimicking our natural hormones or blocking them or just interfering with how they're made or transported.
And where do these chemicals come from? Are they rare?
That's the worrying part. They're not rare at all. They're widespread. Think PBAs in plastics, benzophenones in some sunscreens, agricultural chemicals like atrazine, glyphosate.
Glyphosate, like in weed killers?
Exactly. They're in industrial products, farming, plastics, even personal care things, deodorants, cosmetics, sunscreens again. They're kind of everywhere.
Wow. And how do they impact us, specifically relating back to hormones and skin?
Well, some can act like weak estrogens. This might contribute to things like worsening PMS, which is surprisingly common, affecting maybe up to 75% of women in some places, with pain, mood issues, inflammation.
Okay.
They've also been linked to reduced testosterone levels. It's part of why, average testosterone levels in men are lower now than a few decades ago. It's not just lifestyle changes.
That's quite alarming.
Yeah,
That everyday chemicals could be subtly shifting our hormones like that.
it is. And there's another crucial link back to acne. Remember the microbiome?
Yeah, skin and gut.
Well, chemicals like atrazine and glyphosate have been shown to harm both gut flora and skin flora. They can damage that delicate ecosystem.
So they disrupt hormones and disrupt the microbiome. That's like a double whammy for acne.
It really is. It adds another layer to why maintaining balance is so challenging in our modern environment.
Okay, so this sounds overwhelming. What can people actually do to limit exposure? Are there practical steps?
Definitely. It's about making conscious choices, like trying to avoid plastics, especially for food and water, choosing cleaner beauty and personal care products without known disruptors.
Reading labels, basically.
Yeah, reading labels, looking for certifications sometimes, and opting for organic produce when possible to cut down on exposure to those agricultural chemicals. Little steps add up.
Okay. So wrapping this all up, it's clear acne is way more than just skin deep. It's this really complex interplay, isn't it?
Totally. Between the glands, the bacteria on our skin, inflammation, our diet, our hormones, even these environmental chemicals, it's all connected.
It really underscores how interconnected everything in the body is.
It really does.
Which brings us to our final thought for you, the listener. If all these systems, skin, gut, hormones, environment, are so deeply linked when we look at something like acne, what might that teach us about tackling other health issues, even ones that seem totally separate?
Yeah, something to think about.
Definitely food for thought. Thanks for joining us for this deep dive.